Okay. A very good evening to one and all present here. I, Dr. Komal Lalwani, on the behalf of Nationwide Quality of Care Network, welcome you all to the Community of Practice June 2022 session on delivering quality healthcare services to developmentally challenged children by Dr. Himani Narul. Now, I request Dr. Praveen Venkatagiri, Secretary NQOCN and member of National Mentoring Group NQOCN. He's a head of NCRI National Network. He's a co-founder of Nucleolus EMR and Ovum Hospital and Neonatal Care and Research Institute. He has special interest in Teams QI technology and simulation. I request you to please introduce our speakers of the day, please, sir. Over to you, sir.
Thanks, Komal. Welcome, everyone, for another session, and it's an exciting one. It's my pleasure to introduce Dr. Himani Narula, who's got very unique skills and who has got PhD scholar in public health, Department of Community Medicine from Jamia Hamdard University, New Delhi. He's a developmental behavioral pediatrician and also a co-founder and director of Continua Kids, which is a chain of child developmental centers in North India. She's also a consultant at Madhukar Rainbow Children Hospital as well as CK Birla Hospital, and also is a trustee of Continua Kids Foundation, which works towards the education and health of children. And we should be proud that our colleague has received the Women Disruptor Award for Women Entrepreneur. It's an opportunity to listen to her. We welcome you, Dr. Narula. And welcome, Dr. Narula.
Thank you so much for that kind introduction. And I'm extremely grateful and honored to be on this platform and given an opportunity to share my views, my ideas, and my experiences on this platform. It is my pleasure and honor to be here today.
Thank you.
Yeah. I'll share.
May I just introduce our other panelists as well? Dr. Naveen Jain, who most of us know, is a very well-known neonatologist, teacher, researcher, and also editor of many well-known textbooks, as well as the member of the CPG group. And more importantly, most of us recognize him as one of the pioneers in setting up the Child Developmental Center, and also created the follow-up.
Thank you, everyone. I'll get straight to the presentation, sharing my experience with everyone. Yeah. So, on this platform, I was requested and asked to share my journey as a doctor to entrepreneur, and then how I thought of the idea of opening a child development center. So my motivation began much early in my phase of learning. Right in my MBBS, I was a lot more interested in behavioral sciences. And as I finished my MBBS, I was a little confused as to what field should I take. Should I take up pediatrics or should I take up psychiatry? But then I met Dr. Vikram Datta, and he motivated me to take up pediatrics. And we had a very long discussion and a chat, and I'm really grateful to him for having counseled me at that time and helped me in choosing the right direction for myself. Then I practiced as a consultant in Artemis Hospital in Gurugram, where I thought of doing something additionally because I was taking care of the NICU. And that's when I thought, what happens to the development of a child who leaves the NICU? So much counseling support is required. And then I decided to get trained further, and I got this opportunity to get trained at Child Development Center, Trivandrum. Further, there I was taught by the legends of child development, and I learned a lot in the duration, and I tried to implement a lot of the learnings from there into practice in the hospital, right from creating the, replicating the blue book in the NICU at Artemis Hospital and starting a child development OPD. And further, I then was lacking somewhere in my experience in PhD. And when we did training at CDC, they did train us to conduct research also, and they did motivate us to conduct more and more research to have Indian-based data and a lot of evidence to be able to work in a more scientific manner. So I thought of going ahead and getting myself enrolled for PhD. Again, I was lucky that I could get through the PhD course, and currently I am pursuing my PhD course at in public health at Jamia Hamdard, Himsar, New Delhi. Right from hospital-based practice, where we were looking at high-risk newborn, emphasizing and implementing whatever we had learned at CBC, having regular developmental follow-ups, starting neurodevelopmental OPD, performing a lot of developmental assessments on whatever tools we had gathered from our training. I started implementing everything. What typically happens is we get trained, we forget, and we don't use what we get trained in. But here the motivation was so high for me, and it was so different from what everybody else was doing in the pediatric department, that this motivated me that each and every child should eventually undergo some kind of a developmental screening while they are coming and visiting us as pediatricians. And there, while doing my general pediatric, I started practicing a lot of development and having separate afternoon OPDs for neurodevelopmental conditions. And then gradually we identified the need that there has to be a multidisciplinary child development center, because it was lacking in the northern India part where I was practicing, or in Gurugram, Haryana, Delhi, where there were lack of multidisciplinary centers which were supervised by a developmental pediatrician or having a pediatric neurologist on board or psychiatrist. So the doctors were lacking. There were centers here and there sporadic, but there was no single place where the parent would go and all their concerns around a child with different needs are taken care of. Along with that, having a place where we can have research and also train more people to be able to manage children with different needs. So that conceptualized the idea, and we are very grateful to the head of the department and our colleague at Artemis Hospital, who really helped us day in and out. Me and my other partner, Dr. Pooja, who's a pediatric neurologist, we both together conceptualized the idea that we should have a place where everything is available and the parent doesn't have to run from one nook and corner for different kinds of interventions for their child, which are again not supervised, and they get all kinds of ideas and all kinds of reviews from different specialty people, and not really getting what is scientific and evidence-based. So we wanted to practice more evidence-based. That is where we started Continua Kids, along with the support of all the pediatric colleagues that I had. Then now the idea is there, but this concept had to be brought in brick and mortar form and on ground to be able to execute our dream. So the idea was easy to have. It was good as doctors that we wanted to create something that would help many children with different needs. But we knew there is a problem and we have a solution for it. We can create a solution for it. So the first step was to have an idea and to be able to find that, okay, there is a problem which can be addressed with a solution. So we have to have a problem. Just like any research we do, we have to have a problem. And then we are thinking of whether the solution will work for that problem or not. And we are trying to research that. Here, there are a lot of people who are already helping, but there was no one single place in northern part where the child would come and get all services. So we thought it was an innovative proposal. And whenever we went further, because to run or execute this proposal, there was some amount of fund required. And a lot of times when we went to the investors with this as a business model or a proposal, they would ask, have you tested the idea? Are you are you aware whether this will generate enough revenue to even sustain itself? Because there is a very niche population you are serving, and that too only the pediatric areas. So will you be able to turn it? So we had to then go back, do some homework, get the help of our chartered accountant colleagues and friends, and tell them to help us with making some kind of financial Excel sheets and projections, so that we can go and at least talk to investors who would be ready to invest, one in doctors and second in the idea of having a center like this, a healthcare model like this, which is serving a certain segment of population. It was definitely the need of our, and because there were a lot of sporadic small centers run by therapists, but no single place where things were supervised by a doctor, that became a competitive value proposition for calling it as a business model. Then minimum viable product, they want that whatever you are trying to create as a business model is viable, because it's very important that when we have good intention, we want to create a good facility, but every facility to be created, there is some amount of economics which goes at the back. So then it had to be converted into because it was not a NGO, it had to be converted into a private limited and a business model, and we had to show some kind of a business proposition to it, that it will be self-sustainable after a certain duration of time. There will be some kind of a revenue channel in it, and creating a facility will help. And we also actually presented that how it impacts the GDP of the country. It has a huge impact when you try and address a child by identifying the delays much early on in their phase of development and addressing those in the early years. It can reduce the disability later in their lives, have good long-term outcomes, development outcomes, and have more healthy individuals. And it in the whole thing impacts. There is research evidence which says that it impacts the GDP of a country as well. So right from scientific to business to showing them the impact on the society that it can have, we took us 1.5 years running around, presenting our concept to different investors, and finally making it with a couple of them who trusted us and who agreed to support this kind of a concept and fund the project as a startup model. So we all know now it's important when we are talking about something like this, we know what is the global burden or what is the prevalence. So 1 in 20 children globally have some disability or the other. 15% of global population, which is approximately 1 billion people, live with some disability or the other. And as per the study which was published in PLOS Medicine, 1 in 8 children aged 2 to 9 years are living in India with at least one neurodevelopmental disorder. So the prevalence is actually much more than what it is said, because not every condition was included in 2011 when this disability report was created. Not every neurodevelopmental disorder in Indian context was included as disability. Much later, when the RPWD Act got modified, that the autism spectrum and specific learning difficulties were added to the for disability areas. So from certain things we have to learn from other countries. They have already done research. They have done a lot of economic cost benefit analysis and all the economics behind what happens if we treat children early, identify them early. So they found out that the cost of taking care of a child in autism spectrum disorder is something like $17,000 per year more than taking care of a neurotypical child or a child without autism. So this kind of an information also justifies the cost benefit of treating our children, identifying and treating our children much early on. It is not just impacting, improving the developmental outcomes of children, but it is also impacting the long-term quality and life of individuals who are in the country. later, and thereby impacting their quality of life years. So it is very well known that the prevalence of autism is also on a rise. Various reports from various sources, they have all been showing some amount of increase in the diagnosis of different disabilities. If you look at these charts, although these are annual progress based on the National Health Interview Surveys, they are clearly depicting that there is every year or every few years, there is an increase in the number of the previously diagnosed cases of autism or ADHD or intellectual disability or any other developmental disability. And there could be various factors which could be contributing to this. There could be increased awareness, there could be increase in the number of diagnoses happening because professionals are better trained now, they are more aware, they are identifying them early, or there could be some environmental factors which are actually contributing to the increase in the number of these disabilities and challenges. So we need to keep a close watch on the prevalence. Then what does Continua do? Now, when we started Continua Kids, we started everything at one go, right from psychological assessments to performing all kinds of therapies like ABA therapy, physiotherapy, developmental screenings and assessments, special education group sessions, aquatic therapy also. We used to have a swimming pool which was temperature regulated, and we used to do aquatic therapy also. It was very difficult to find trained people who could understand and who were trained to do aquatic therapy. Music therapy we would do, yoga therapy, speech language, role plays, and these are all pictures from our work in our clinics. And a lot of parent training program. We used to have a parent training program till lockdown happened. We used to have all physical parent training programs where we would talk to parents about all the possible questions that they had around any neurodevelopmental condition. We would pick up one condition and have a half-day session for the parents. Every month we would have one session on different neurodevelopmental condition to generate a group of parents who are more aware and help them in managing their children at home. But as we progressed, we found that it was difficult to sustain therapies like aquatic therapy because the cost of maintaining a swimming pool with all kinds of water treatments and checking the quality of water, making sure that the person who's trained is coming and it is safely happening. So there's a lot of support which is required. So financially, it was very difficult. So after 2 years of running an aquatic therapy program, we had to shut that part out. That was a learning for us where we felt that it was very difficult to sustain an aquatic therapy if you don't have enough fund and trained people. Coming to music therapy, we had a team of music therapy people who run a London music therapy school in London, and they were treating children on autism. But because of lack of evidence, it was very difficult for us to tell parents to get enrolled in music therapy as the first line of treatment, because that was not which has that much of scientific evidence. So as a complementary therapy, we started a research also based on that, but eventually the amount of effort which was going and the number of children which could be helped was not satisfactory. So again, that segment also was closed down. Rest all the activities we are still continuing in all our various centers. So I'll just quickly run through our journey so far. We opened in December 2016 with one center in Gurugram with a staff of about 20 people, all therapists and admin staff inclusive. Gradually, by the end of 2 years, we had gone up to 6 centers in Delhi, Gurugram, Noida, and Faridabad. Our staff got doubled. And by the end of 2020, we had 8 centers which were running. However, when the lockdown hit, post-lockdown, we had to shut down 4 of our centers. And gradually, we started opening one by one because children with special needs were really facing challenges. During the lockdown phase, we did a lot of Google Meets and online webinars and sessions. We had all our patients invited for those sessions, and parents, you won't believe, would join in hundreds of numbers to attend those sessions by therapists, by us. They were all free so that the parents have some support at least while they are sitting at home and spending that time with the with their child at home, because they were clueless now what to do, how to manage. The child cannot go out. So we ran like multiple sessions during the lockdown times, and that kept us also connected with a group of parents, and that I think continued their trust in us that we are not going to leave them alone in crisis. And our team supported us wonderfully. So post lockdowns also, we gradually opened, and by the end of December 21, again we had 10 centers up and running with a staff of 75 to 80. Currently we are 15 centers across North India, and so far we have done 2,26,768 hours of therapy with more than 11,000 children enrolled, including all our centers, and we have a staff of 100 plus. We've done OA screening. I was extremely motivated by our newborn hearing screening program, which was run at Kerala, and I was very highly motivated, wanted to do something like that in Haryana as well. But you need a lot of bureaucratic support when you want to run a hearing screening program in the whole state. So we did try a little, but we could not take it forward. So we started through our Continua Kids Foundation. We bought an OA machine and we started newborn screening in the smaller nursing homes. And so far we have done 1,000 plus hearing screenings, and EGs are also done at our clinic because we have a pediatric neurologist support with us. Dr. Pooja is also a co-founder to Continua Kids, and she's a pediatric neurologist. We have a big team now of all specialties, from pediatric neurologists, developmental pediatrics, psychiatrists, clinical psychologists, counseling psychologists, occupational therapists, physiotherapists, speech language pathologists. So all these people, whenever we are recruiting them, we have a specific documented HR protocol. They have to have a specific degree, their documents, their RCI numbers. They all have to submit all these numbers to get an appointment with Continua, and because that helps us to maintain the quality, because here we are talking of quality. When we are talking of quality, the kind of training that a particular therapist is having is extremely important. Their qualifications and the evidence to their qualification is extremely important. So that's where we take up all their documents, and we have a proper HR portal which maintains the documents of each and every employee when they are selected or recruited, and there are proper letters of their rights and responsibilities which are given at the time of their recruitment. Then we have a good admin staff, and we have legal advisors, financial advisors, branding and advertising team, which helps us to create a buzz on neurodevelopmental concerns, raising a lot of awareness, because they are the people who expose our efforts and our efforts to the people on social media, and that also has helped hugely. So I will say that having a marketing team or a social media team can really help create a buzz about, or if we want to raise awareness in the community, because everyone has a gadget in their hand now. So we can really make very good and effective use of these methods to raise awareness about different issues. Now coming to the cycle of quality care. As we know, there's this whole cycle. How we follow this cycle at Continua Kids will go slowly one by one. So when it comes to physical comfort, patient-centered physical comfort, yes, we try that the areas are accessible. There are lifts, there are wheelchairs, there are housekeeping staff to support. The areas are air-conditioned or heated in cold, because Delhi can get very cold and it becomes very difficult to do therapy for children in those. So we manage all those. They are well lit, natural light is there, CCTV coverage of all the therapy areas is there. Parents are allowed to be in the therapy area so that they can be trained, and if we feel that the child is comfortable, then the parent exits the therapy area and they can sit in the waiting area and watch on CCTV what is happening in the therapy area, so that they feel secure about the safety of their child. And also they can learn by watching what all activities are being done in that area. And after each session, 15 minutes, the therapist spend with the parent in counseling them and equipping them with what all they can practice at home. Again, there is a free Wi-Fi for parents because it's online. Everybody's working online. So parents are not motivated because they have to work online. They want to sit at home because their working is getting affected. So it is basically making everything accessible and helpful. There are so many parents who want to continue working while their child is undergoing some therapy because they want to give therapy also to their child. So for their support, we created an area where they can sit and work also while their children are undergoing therapy. There's a library facility. Parents take up books from those library and they can read information. There is a lot of reading material, books, magazines for parents, which will help them to educate themselves and on how to manage children. There are play areas, parking spaces, and the children are allowed, parents are allowed, and there are feedback forms with boxes where they can put a feedback without disclosing their identity. So we have a feedback box in place, and that is checked at the end of every 3 or 4 days, and those feedbacks are then addressed. Other methods, how we respect patient value. So now the second aspect is every child has a software generated unique identification number. So we have a software in place. The moment the child walks in, they have a unique identification number. Rights and responsibilities are written and displayed in our clinic for the parents, and informed and written consent is signed by the parents before starting an intervention program for them. Written consent is also taken for clicking photographs and videos. Unless they allow and give us a written consent, we do not use their pictures or videos, or do not take their photos and videos. Patient identity is kept confidential, it is not shared. Accommodation of a missed therapy, or if for any reason the child is not all right, for some, we have those arrangements so that the patient don't feel that it is purely a place where they have to come, give money and take the sessions, but we do accommodate them in various ways because we have to be equally empathetic and understanding of the situation that the parent is in. So I think somewhere being doctors, we understand that aspect equally well. A written cancellation policy is also there so that it is all transparent. Parents should know everything beforehand. What is going to happen, how it is going to be. And this all we have learned over years with practice as to how we can improve, what are the challenges we are covering, and each and every challenge then we try to address as a problem, we try and find a solution to improve upon that. Now coming to integration of care, how we integrate. There's so many therapies, there are doctors, there are psychologists, how do we integrate their work together? So yes, the moment the patient walks in, there's assessment, diagnosis, planning, implementation, and evaluation. These are the steps that we follow. We use a proper app. We have a Continua Kids app, and there are 2 apps basically. One is for the doctors and the therapists to use so that they can document what is their assessments in the app from doctor's side, and once they sign their reports, they can be viewed by the patient on the parent app side. Then parents can book appointments, they can look at their schedules, they can look at their receipts, everything they will be able to see through that app. The parent app. So they have records of everything, their past consults and all. So then how it is planned, planning integration again can be very specific. Each and every child which is walking in has to be seen by a developmental pediatrician, pediatric neurologist, or psychiatrist before the patient goes in for any intervention. Counseling of the parent is done thoroughly on the induction time, or when the diagnosis is made. We take 1 hour, 45 minutes to 1 hour is the session that I have with my parents when we are counseling and talking about what is the diagnosis, disclosing diagnosis, and talking about the intervention plan. Then we plan detailed development assessment, DQ, IQ, whatever the child needs according to their age. Diagnostic assessments are done using standardized, every possible standardized tool right now we have in our clinic. All questionnaires we have trained clinical psychologists with the right kind of a degree. They need to be MPhil to be able to sign and make a report. We always have those people who are well trained, and a soft copy of every assessment is kept saved with the organization, and a copy sent to the patient. Every single therapist also has their own set of performers which are structured and they're in place, which they can use for assessment of the child. First, they'll conduct their own assessment in every therapy area, and then they will form a set of action plans or goals for the child, and then those goals will be tracked at their level. They have a provision to write a small session note after every session. They can write a small session note in the app, which can be read by the parent. If the child is coming with a grandparent or a caretaker, then the parent can know what was done today and what was recommended through the session note that happened. Follow-ups are done on monthly basis, and some detailed reassessments are performed every 3 months to evaluate the progress of the child. Every month we recommend follow-up with the doctors also, so that there is a chain which is there. We sometimes conduct neuro board kind of meetings where we incorporate parents and various specialty therapists and discuss the case all together if things are not working in the right direction. And all the patient files are maintained in the software. We are working very hard because it's very difficult to convince each and every person, therapist, to put session notes, to use the information system. It needs a huge level of behavioral change. But as doctors practicing in hospital, where we were already using a hospital information system, we thought this system should be there in centers also, so that documentation is better. And then only we'll be able to create more evidence. We've still not reached to the maximum level of quality documentation, but we are struggling very hard, trying to train our staff on those areas. Parent family empowerment is done on a very regular basis. You can say weekly sessions are happening, Facebook live sessions, webinars, different routes are followed. Community support participation. I had participated in various national and international programs. We do teacher training programs. We go to the play groups and schools, and on a very regular basis conduct training for teachers and parent training, so that they are aware and they can participate in early identification and bring the child whenever they have questions around. And we try whenever we get an opportunity to support the government programs. We have participated in Amritsar and in Delhi with the National Health Fest, which for Divyanjan. And a very important segment and a part that I'm very proud of is that when we were conducting all these therapies, there was a segment of parents who could not afford the therapy. So we could waive our consultation for those parents as doctor, because we know that they cannot genuinely afford. They are underprivileged. But providing them with the same quality of care was becoming very difficult. That is where we thought of tying up with certain NGOs who can support these children. So we had various NGOs on board, and we also had Hero Honda Group of motorcycles, who used to sponsor 20 to 25% of underprivileged children for intervention, which we do very regularly before the lockdown happened. And still we are always continuing to have a parallel wing where we arrange for funds for management and treatment of children in underprivileged sectors through various NGOs. So we have tie-up with various NGOs through which we sponsor these children for interventions. Of course, media presence, we all know, can create a lot of buzz around these topics, create awareness, people reading, and they want to know what is happening and what should we do. So we have on monthly basis, you would say we have 4 articles being published in various newspapers around neurodevelopment, around mental health, around disability. So that's the amount of work we are trying to do. Then we always talk about having insurance cover for autism. Personally, also, it's very close to my heart, and I've been working very, very hard. So many health insurance companies we have approached, but so far none of them have been able to solve the riddle and accept a program where they can have an ongoing outpatient insurance covered partly or fully for children on autism spectrum in India. So that is one area. By creating a buzz, we want that some support should be there, because parents really will be much more motivated, and for those who cannot afford, there also the children will get support. We are not always able to create support for every child. We try our best, but it is not 100% most of the times that there is lack of fund. So Now, talking about how we take a feedback from the parent, we need to involve them. We need to get their feedbacks, reviews from them, positive, negative, all kinds of reviews are accepted. Each and every negative review that we get on Google, it's not that we get 100% reviews all the time. We get negative reviews, we get frustrated comments also on the Google review, but it helps us to know, okay, what was the point, why the parent felt like that. And then we call and we try and rectify and modify each and every pointer, that every feedback which is negative helps us to get better. So Google links are sent for feedbacks to each and every patient. Every feedback is seen by either me or Dr. Pooja and acted upon if there is a concern there. Manual feedback forms are also available. They give manual feedback in certain therapy areas. Also, the team takes their feedbacks after every monthly review or observation that they give to the child. We conduct tea and coffee sessions with parents in small groups once in 3 months to get their feedback in the form so that they can talk to us personally and express their challenges. Parents can email us their grievances, and we have a documented policy for grievance redressal in place. We have SOPs made for everything which is happening, how to create a new center, what is the SOP, what are the guidelines, everything is documented with our admin team as well. Training programs and internship programs also we conduct. We had got a health sector, National Council Health Sector course recognized for conducting autism assistant course for 3 months. Parents, teachers, or 12th pass students who have relatives or who want to work in this area can undergo this course. And we are yet to start this, but we have got the approval and we'll be starting soon. And we have other undergraduates, internship program, clinical psychologists from various universities like MIT Christ, IPH Flames. All these university students have had experience of working and undergoing internship programs with us. And we always have the desire to acquire more and more knowledge. Participating in CMEs is a pleasure and a learning experience. And sharing our work on those platforms also helps us to grow and learn more. So we continue to do that. As far as the employees who are I would say the real pillars of the organizations, their roles and responsibilities are important. So they have their ID cards, software trainings, written roles and responsibilities are always documented and signed by them at the time of induction. Internal training and webinars we conduct for the training of the new therapist. Involvement of the senior therapist with more experience as supervisors is there. Annual picnic celebrations are also there for them. Involvement and motivation to participate in research. We always motivate them. For those who really want to conduct research, we have special educator who had presented in a conference on special education. Occupational therapist had presented a couple of papers. So we always promote research also. And written employee grievance policies also there. Prevention of sexual harassment. Also there's a written policy in our organization. So these are the various social media handles. You can scan the barcode for visiting the website and you'll get to know more about Continua. This is how the app looks like, Continua Kids app. This is parent app, which is available on both iOS and Android. This is how the app looks like. There are a lot of assessments, they can record other things also, but our focus is more on the development. The other things are just supportive. And we have growth charts where they can, if they write the head circumference, weight and height, the WHO growth charts, it'll get plotted there on the charts. So they can maintain their records, they can keep their files, they can save a photo of their documents or scan copy or PDFs of their documents as a folder in the app as well. So we have written a couple of chapters in this book, Shaded Justice and Rights of People, on the rights of children with disability and various topics. We have a couple of chapters which we had contributed. Now we are also working towards creating more and more resource to help parents work at home with their children. So we had created, with the help of our special educator, a book to empower children. This is especially to improve their visual recognition and outcomes. Way forward, we want to have online programs, home programs video intervention programs, structured ones. We are doing, we have started doing it, but we want to structure those programs and integrating screening tools so that the parents have access to screening, school intervention programs for teachers, parents, parenting, partnering the schools in setting up various teacher training programs and health insurance policy, including autism intervention, is something that we really, really want to change and bring. And we are hoping for a brighter future for all our children, inclusive of any child with any unique ability or different ability or special need. Thank you so much for patiently listening to this presentation of mine. And I believe we have a lot of scope to improve, and we'll learn from our experiences more and more to get better.